Welcome to NeuroFrontiers, a series in which practical neurology partners with ReachMD to bring you clinical research and advancements that further clinicians' ability to diagnose and treat neurologic conditions. In this episode, Jae W, MD, Associate Professor of Radiology at the University of Pennsylvania, discusses the diagnostic value of intracranial vessel wall MRI for vasculitis, as well as when clinicians should order this imaging technique and the challenges that may arise. Dr. Song, thank you so much for joining us today. It's a pleasure to be with you.
Yeah, I'm excited to be here and talk about vessel wall imaging with you.
Excellent. As a starting point, when should neurologists order intracranial vessel wall MRI?
I think there are two main primary and clinical indications. First is when you already know the patient has some sort of vasculopathy. So typically at my institution, for instance, patients will come in and already get a CTA of the head or imaging workup of some sort of neurologic deficit. And then from there, you can already visualize that there's an abnormality with the vessels because you see stenosis, for instance. In which case, the next question is what's causing the stenosis? And so one of the clinical applications for intracranial vessel wall MR imaging is to help sort of narrow that down to identify whether or not that's an inflammatory cause or a non-inflammatory cause. So that's one primary indication where you already know that there's some sort of vessel abnormality. And your next question then is to narrow it down to ask what kind of abnormality. The other main indication that I see commonly at my institution is when you have a cryptogenic stroke patient. So you've done the full workup, and you still don't know what has caused the stroke or the recurrent stroke. And then the question becomes whether or not you're just not seeing the vessel abnormality because the stenosis is so mild that it's not very obvious on lumen-based techniques such as CTA or MRI. And there's situations where patients can get outward positive remodeling of the vessel wall, which means that there's a wall abnormality, but the wall can accommodate that abnormality and not result in stenosis. And so then you wouldn't expect to see an abnormality on the CTA or MRI. And so those are the two primary indications. Vasculopathy is already known. Next question is what kind of vasculopathy? So vasculopathy differentiation. And then second indication being a patient that has a cryptogenic stroke and you want to just complete the workup.
Thank you so much for that overview. Given the variety of imaging techniques, how does intracranial vessel wall MRI complement other imaging techniques?
I think that it adds to existing techniques that patients are being worked up for. So for instance, because the pathology occurs in the wall, the site of injury is what you want to image, right? Why not image the primary site of pathology as opposed to looking for secondary findings such as stenosis or dilatations? In addition to getting that lumen information, I think it's helpful to get the anatomic wall pathology information. And I think together you have a bigger and more complete picture of what might be happening in that patient who might have some sort of vasculopathy. And so you get both of that information, lumen information from either a CTA, MRI, or a DSA, as well as the wall itself, which is not present, that cannot be evaluated on those lumen-based techniques. If available to you, why not get all of the information to come down with a diagnosis before doing something more invasive?
Having described the efficacy of this imaging technique, what is the process of making intracranial vessel wall MRI available at one's institution?
At my institution, we have a dedicated protocol for vessel wall MR imaging because it requires specific kinds of pulse sequences that are optimized to look at the vessel wall. So you might understand that to visualize the vessel wall itself, which is very small, you need to have high spatial resolution. And your routine MRI brain images usually do not have that level of spatial resolution. And so working with your neuroradiologist or your radiologist at your home institution, I would recommend developing a protocol together where you have that specific pulse sequence that is optimized to visualize that vessel wall, specifically meaning that you need pulse sequences that are high spatial resolution. The guidelines for vessel wall imaging is to use either range from 0.4 to 0.7 millimeters spatial resolution to be able to accurately detect and visualize that wall pathology.
Lastly, what are some of the challenges associated with the use of this test?
So going along with that, it's not always easy to find your neuroradiologist who's willing to spend time with you in terms of developing and optimizing your protocol. So that's one of the challenges. I think there was a survey that was distributed from the American Society of Neuroradiology that discussed some of the challenges, and one of them was protocol development. So I can understand how that might be one challenge. Using both vendors, for instance, our institution uses Siemens, and so Siemens application scientists, they will help us in addition to having the radiology team develop that protocol. Because you need high spatial resolution, some of these sequences can be long. You can imagine for a patient who has stroke, who might be delirious or might have claustrophobia, there are patient-related challenges as well, just because the protocol can be long. You want to be mindful of who can actually tolerate this protocol and stay in the scanner long enough to be able to tolerate this exam. At my institution, the protocol is roughly about 45 to 60 minutes. You can imagine laying flat and still in a small, MRI console might not be the most comfortable situation. So there's patient-related factors as well. And then finally, I think the other barrier is just education, right? So neurologists might not be familiar with the indications of when to order it, when it might add value. And then similarly, for radiology as well, there's still an effort, an initiative to educate the general neuroradiology and radiology services out there in terms of utilization, interpretation, and optimal imaging. Those are the three main barriers: protocol development, and then tailoring the protocol for patients that might be able to tolerate a lengthy protocol, and then overall education, not just radiologists, but neurologists as well together in terms of where it might add value and how to interpret these cases.
Thank you. And any last thoughts for our listeners?
Yeah, I think once you have a good protocol and you have a great team member that is really interested in cerebrovasculopathies and can interpret vessel imaging, we've seen a wide range of really interesting cases at my home institution where it's actually added value and helped diagnosis. And I think in that regard for patient care, it is something that in the right place and with the right patient, it can really help. And so I would encourage anybody who's interested in cerebrovasculopathies to look for vessel imaging type cases, to find your radiologist that might be able to help you curate a protocol and work together for these types of cases, because they've been some really interesting pathologies that we've been able to visualize that you otherwise would not see, because on the typical lumen-based techniques, you just don't see the wall itself. I think it's an exciting field. I think it's an exciting technique, and I think it's fascinating. I'm glad that there's interest among the neurologists who want to learn more about it.
It's a really helpful overview. Thank you so much for your time, Dr. Song.
Thank you very much for having me.
Thank you to Dr. Song for sharing her knowledge with our listeners in this episode of NeuroFrontiers. And thanks to you, our listeners. Be sure to visit practicalneurology.com for more podcasts in the field of neurology.